in terms of arthritis, we usually start with anti-inflammatories. That can be NSAIDs, which is non-steroidal anti-inflammatory drugs. That can be, say, Advil or Aleve. And oral steroids are very effective, but they do have some side effects. And I mentioned the DMAs that usually are used for rheumatoid and similar types of arthritis. You can get injections. One thing I didn't put here, and I should have, is only because I started doing it a lot more in the last year, is I'm using orthobiologics that can include PRP, platelet-rich plasma, where I draw your blood, we spin in the centrifuge and inject the concentrated platelets and plasma back in, and we can put it directly into a joint, and that will really retard the arthritic process and help with pain. It's certainly more costly than a regular steroid injection, but the problem with cortisone and similar agents actually accelerate, in many cases, the disease process. So it's very important to be aware of that. Therapies are very useful just for motion and strength, but it's not going to really affect the arthritis itself. So important to understand that, and as well as splinting. Splinting is for comfort, but a splint sometimes may just make you stiff. And then there's surgical treatment, which is extremely effective and something not talked about much because, frankly, my colleagues in primary care, I think they're not as aware of what we're able to do nowadays. And that's our fault as physicians. We often don't educate each other enough that affects you, the patient. So surgical treatments can include simply synovectomy, meaning removing the joint lining, and that can be done open or arthroscopic, which happens to be one of my particular areas of interest in the hand surgery field, and I'll elaborate on that later. Now, we can also fuse a joint, and for some joints, that works very well. A good example is the last joint. Many of you look at your finger, the last joint, you probably have a little bump or a knob there, and that is typical of osteoarthritis, and that's called a Heberden's node. There is no joint replacement for this last joint, so there we fuse it. We get rid of the motion, but that gets rid of the pain. We take away the bumps. It's a simple outpatient procedure. But most of the time, patients prefer motion, of course, and most of the joints now in the upper limb don't undergo fusion. Many years ago, they used to fuse the knee joint. Some of you may remember having a relative who would sit down at a family reunion and stick his leg straight out. That's because he couldn't bend it. Now all of you know that we do knee replacements, and we don't talk about that because I'm not a lower limb surgeon, but obviously I'm going to mention the most common joint replacement, at least in the U.S., is a knee replacement, followed by the hip. But I'll be talking about shoulder and elbow and other sort of less discussed things. And that's called arthroplasty. Plasty means change, so that's where we change or replace the joint. And it can be with synthetic materials as a prosthesis. Now here is arthroscopy of very small joints, something that even my colleagues in hand surgery, a lot of them actually do not do this. I've been kind of a pioneer in some of the particular procedures. So this is the small joint in the thumb, the metacarpal phalangeal joint. I also scope this joint, which we'll talk about later. That's the most common one I do actually. And this is the knuckle in the index finger. So you see here in the camera, here's the joint surface, and right here is the synovitis. So I'm removing that physically with two little holes that I don't even put a stitch in. So when people think about surgery, they imagine this big deal. This is a 20-minute outpatient procedure with no scar. So once these little holes here, you don't even see them. So we have to change, I think, our perception about what surgery means. So arthroscopy, as I mentioned, it allows us to clean up the joint or take out the joint lining, which produces the chemicals that your brain interprets as pain. So we can do a synovectomy or remove the joint lining. That will give excellent pain relief. The question will be how long it will last, and that depends on what the underlying problems are. So we can do this in shoulder, elbow, wrist, the base of the thumb, which is the thumb carpal metacarpal joint, and these small joints here called the metacarpal phalangeal joints.